Think for a moment about the last time you truly read the tiny print on a medication bottle without extra light, without asking someone for help, and without struggling to focus. If answering that question takes effort, then what follows is especially relevant. Many adults beyond the age of 60 assume worsening eyesight is simply a consequence of aging eyes. Yet a different process may be contributing. Day after day, chemical changes occurring in the bloodstream can affect the body's most oxygen-dependent tissue. In many cases, stronger eyeglass prescriptions address the symptom, while the underlying process remains unexplained. Before discussing the biological mechanisms, there are several warning signs that require immediate attention from an ophthalmologist. A sudden decrease in sight affecting one eye over a matter of hours, the appearance of a dark shadow moving across vision, a rapid onset of numerous floaters that were absent the day before, or recurring flashes of light at the edge of vision may indicate retinal detachment or acute hemorrhage. These situations require same-day medical evaluation. For those experiencing a gradual decline in clarity over months, halos around headlights during nighttime driving, increasing dependence on updated reading prescriptions, or persistent haziness that glasses cannot completely correct, the following mechanisms may be involved. The first mechanism involves changes in the eye's lens. Many people notice that their vision seems sharper on certain days and blurrier on others. Some mornings appear clearer. By afternoon, focus may worsen. After eating a meal rich in bread, pasta, or sugary foods, objects may appear less distinct. Fatigue and lighting are often blamed, but another explanation exists. The transparent lens located behind the pupil receives no direct blood supply. Unlike organs such as the liver or heart, it depends on surrounding fluid for nourishment. That fluid reflects changes occurring in the bloodstream. When blood glucose rises significantly after eating, glucose enters the fluid surrounding the lens. Inside lens tissue, an enzyme transforms excess glucose into a substance known as sorbitol. A critical feature of sorbitol is that it becomes trapped within the lens. According to research described in NIH Stat Pearls, sorbitol is generated more rapidly than it can be further processed, and its molecular characteristics prevent it from leaving the cell efficiently. As sorbitol accumulates, it attracts water. The lens absorbs that water and expands. Similar to a dry sponge placed into water, the structure increases in size and changes shape. Once swollen, the lens can no longer focus light with perfect accuracy. Images that were previously crisp begin to look blurred. At this stage, the change is not permanent damage. It is a reversible fluid shift. The concern arises when this cycle repeats continuously. Swelling followed by shrinking, occurring day after day, month after month, and year after year, places stress on lens proteins. Eventually, those proteins become altered, lose transparency, and harden. That progression leads to cataract development. Temporary blur gradually becomes lasting cloudiness. A review published in the Journal of Ophthalmology identified activation of the polyol pathway and the resulting osmotic stress as major contributors to diabetic cataract formation. The same biological process can affect anyone whose blood sugar remains elevated frequently enough and long enough. Eye examinations often measure the optical consequences of this process and correct them with lenses. The underlying mechanism itself is rarely evaluated directly. The second mechanism involves failure of tiny blood vessels. At the back of the eye lies the retina, an extremely thin layer of light-sensitive cells responsible for transforming incoming light into signals the brain can interpret as images. This tissue depends on some of the smallest capillaries found anywhere in the human body. These vessels are so narrow that red blood cells move through them one at a time. There is little redundancy within this system. These capillaries serve as the retina's essential lifeline. Without adequate blood flow, photoreceptor cells cease functioning within minutes. Persistently elevated glucose damages these vessels through a process called advanced glycation. When glucose molecules attach to proteins, especially at higher concentrations, those proteins become chemically altered. Flexibility is lost. Structures stiffen. Capillary walls are designed to regulate movement of substances while maintaining elasticity. As glycation progresses, the vessel walls become increasingly rigid. Eventually, they crack and leak. An important point is that this process does not require a formal diabetes diagnosis. Research published in the journal Diabetes Care reported that retinopathy was already present in approximately 7.7% of adults with prediabetes within a nationally representative United States population. These individuals had never been diagnosed with diabetes. A 2022 systematic review published in Acta Diabetologica found a median retinopathy prevalence of 7.1% across pre-diabetic populations worldwide. Current diagnostic thresholds for diabetes were not created to identify this early level of damage. What matters is cumulative glycation exposure. That exposure reflects the complete glucose pattern throughout daily life. It depends on how high blood sugar rises after meals, how long it remains elevated, and how often that cycle occurs. Post-meal glucose spikes contribute substantially to that cumulative burden. A 2020 study from the Northern Finland birth cohort demonstrated that, among non-diabetic individuals, signs of retinopathy were significantly associated with glucose measurements taken 30 minutes and 1 hour after a glucose load, rather than fasting values alone. This suggests that blood sugar behavior after eating carries important implications and is rarely measured during a routine appointment. Someone with a fasting glucose level of 98 may appear completely normal on laboratory testing. However, if that individual consumes 3 high-carbohydrate meals each day, skips fiber sequencing, remains sedentary after eating, and neglects protein at breakfast, glycation-related injury may still be accumulating within retinal capillaries every day. Standard laboratory reports may not reveal the problem until meaningful structural damage has already developed. As these capillaries begin leaking, fluid enters retinal tissue. Swelling follows. Visual signals become distorted. This process represents the biological beginning of retinopathy. The condition is often diagnosed only after measurable damage appears, even though the underlying process may have been developing for years. The third mechanism involves loss of protection within the macula. The macula is a specialized area of the retina responsible for the sharpest and most detailed aspects of vision. The ability to read, identify faces, and notice the fine details that make everyday life manageable depends heavily on a small region within the retina known as the macula. This area is at the center of macular degeneration, one of the most common causes of irreversible vision loss among people older than 60. The macula relies on 2 important pigments, lutein and zeaxanthin, for protection. These compounds function as a natural filter positioned in front of the photoreceptor cells. They absorb portions of blue and ultraviolet light before that light can reach and injure the tissue beneath. You can think of them as permanent internal sunglasses, working continuously without interruption. What causes these pigments to disappear more quickly than almost anything else is oxidative stress associated with poor blood sugar regulation. When glucose levels remain elevated, the retina becomes exposed to large numbers of free radicals. These chemically active molecules attack cellular components throughout the tissue. Lutein and zeaxanthin are used up while neutralizing those free radicals. They are effectively sacrificed to preserve the structures underneath. Once the concentration of these pigments falls below a critical level, incoming light reaches photoreceptors without adequate filtering. Damage then accumulates over time. Macular degeneration is often not the result of random chance. In many situations, it reflects an imbalance between depletion and replacement. The protective resources of the macula are consumed faster than they can be restored. Many adults over 60 already have low stores of lutein and zeaxanthin because they consume too few dark, leafy vegetables. When blood sugar instability is added to that situation, the loss of those pigments accelerates substantially. The fourth mechanism involves increasing pressure within the eye. This pathway links vision health to an organ most people rarely associate with eyesight: the kidney. The eye and the kidney share an important biological characteristic. Both depend heavily on delicate blood vessels that are especially susceptible to glycation-related injury. This similarity is not accidental. It reflects a common vulnerability. As a result, individuals who experience long-term blood sugar dysregulation often show declining retinal and kidney function at the same time. The relationship extends beyond the vessels themselves. Kidney performance can deteriorate significantly before noticeable symptoms appear. As that decline progresses, the body's handling of fluids changes. Blood pressure frequently rises. Blood pressure influences the pressure inside the eye, referred to by physicians as intraocular pressure. Elevated intraocular pressure is the primary force driving glaucoma. Glaucoma damages the optic nerve rather than the retina itself. The optic nerve serves as the communication cable carrying visual information from the eye to the brain. Peripheral vision is typically affected first. The process advances gradually and without pain, allowing many people to lose a substantial portion of their visual field before recognizing a problem. The sequence often unfolds as follows: blood sugar dysregulation, microvascular glycation, kidney stress, increasing blood pressure, elevated intraocular pressure, and finally injury to the optic nerve. Although these issues are commonly treated as separate conditions managed by different specialists, they are actually part of one connected chain. Blood sugar represents the first link. Consider the experience of a woman called Margaret, 71 years old and a retired schoolteacher. She did not have diabetes. Her fasting glucose never rose above 104. For years, her physician told her that her laboratory results looked appropriate for her age. Yet during the previous 6 years, Margaret required new eyeglasses every 18 months. Each prescription was stronger than the one before. Each adjustment provided clearer vision for a while, followed by a gradual return of blurriness. Her ophthalmologist had documented early drusen deposits, small accumulations of protein beneath the retina that indicate risk for macular degeneration. The recommendation was simply to observe the situation over time. For someone watching vision slowly decline, that advice offered little reassurance. When Margaret described her symptoms more thoroughly, a clear pattern emerged. Blurred vision became noticeably worse later in the afternoon. Her eyesight was at its sharpest first thing in the morning before eating. Following her typical evening meal, usually pasta or rice and sometimes a small dessert, halos around kitchen lights became nearly disorienting. On days when she ate mostly eggs, fish, and vegetables while keeping starch intake very low, she felt her vision was clearer. She had never connected those observations because nobody had suggested the connection. Her eye specialist measured refraction rather than glucose patterns. Her primary care physician focused on fasting glucose rather than post-meal elevations. No one was examining the complete picture. Margaret's glucose level 1 hour after eating had never been formally tested. After she began monitoring it with a basic glucometer, the results surprised her. Following a typical dinner, her glucose reached 178. She was not diabetic. Most guidelines would not even classify her as pre-diabetic. Yet those elevations were occurring multiple times each day, year after year. After following the protocol described later for 4 months, her afternoon blurring decreased significantly. Nighttime halos became far easier to tolerate. At her next ophthalmology appointment, the drusen deposits had not progressed. The injury that had already occurred did not reverse. That is not how biology operates. However, the conditions promoting further damage had changed. For Margaret, that change meant everything. The fifth mechanism involves nutrient depletion. Among all the factors discussed, this one is the most readily correctable and often the most overlooked. 3 nutrients are especially important for retinal performance, and all 3 can become depleted under the metabolic circumstances already described. The first is thiamine, also known as vitamin B1. Thiamine plays a critical role in glucose metabolism within neural tissue. The retina functions as neural tissue. In practical terms, it is an extension of the brain. When blood sugar remains chronically elevated, thiamine is consumed more rapidly as the body processes the increased glucose burden. A peer-reviewed investigation published in the journal Diabetologia reported that high glucose environments interfere with thiamine transport within retinal cells and across the inner blood-retinal barrier. As a result, the retina may fail to receive the thiamine it requires even when adequate amounts remain present in circulation. Ganglion cells within the retina are responsible for collecting and transmitting visual information. When these cells become deficient in thiamine, signal quality deteriorates. Vision may appear less distinct, less sharp, and lower in contrast. Imaging can show an eye that appears structurally normal, while the underlying issue remains biochemical. The second nutrient is magnesium. Magnesium participates in more than 300 enzymatic reactions throughout the body. Among its many functions are regulation of blood vessel tone, protection of neural tissue from oxidative injury, and support of insulin signaling. Magnesium deficiency worsens blood sugar instability. Poor glucose control then further depletes magnesium. The cycle reinforces itself in a single direction. Most adults older than 60 have insufficient magnesium levels without realizing it, because magnesium is not included in a standard metabolic panel. The third nutrient is zinc. The retina contains one of the highest concentrations of zinc found in any tissue within the body. Zinc is required for the visual cycle, the biochemical process that converts incoming light into nerve signals interpreted by the brain as images. It also supports antioxidant enzymes that defend photoreceptor cells against oxidative damage. Absorption of zinc declines with age, particularly as stomach acid production decreases, a change affecting the majority of people over 60. When zinc levels become low, the visual cycle slows. Retinal defenses weaken precisely when oxidative stress related to blood sugar dysregulation is increasing. These three nutrients are depleted through the same metabolic pathway. All three can be replenished through targeted food choices. The protocol begins with the morning meal. Start the day by consuming protein and fat before any carbohydrate. 2 whole eggs prepared in any preferred manner can be combined with smoked mackerel, sardines, or plain full-fat yogurt. For those preferring a lighter option, a small handful of walnuts mixed with yogurt is another choice. The objective is not to eliminate carbohydrates from breakfast. The purpose is not to remove carbohydrates from breakfast. The goal is to establish metabolic stability before glucose enters the system. A morning meal built around protein and fat first can significantly reduce the early glucose surge and help limit sorbitol buildup within the lens during the first 2 hours after eating. What happens to blood sugar in the morning influences the metabolic pattern of the entire day. A large spike early often means glucose remains elevated through much of the waking period. Start the day on a flatter curve. The next piece involves lutein and zeaxanthin, and this is where many people make a critical mistake. Include dark leafy vegetables with breakfast or an early afternoon meal. Spinach, kale, and collard greens are all suitable choices. Whether those vegetables are eaten raw or cooked is less important than the foods paired with them. Both forms provide lutein to the digestive tract. The factor that determines whether lutein ultimately reaches the macula is dietary fat. Lutein and zeaxanthin belong to a group of fat-soluble carotenoids. Research repeatedly demonstrates that these compounds require fat within the same meal for meaningful absorption. Without fat present, much of the lutein simply passes through the digestive system with minimal uptake. Add 1 teaspoon of olive oil or a small amount of butter when preparing or serving the greens. That fat is essential. It transforms the vegetables from a simple side dish into a functional nutritional tool. During the day, one practice should apply to every meal. Consume fiber and protein before starches and sugars. Begin with vegetables and protein. Leave bread, rice, fruit, or desserts until the end. This simple adjustment in meal sequence has been evaluated in multiple clinical investigations. A controlled trial conducted at Weill Cornell Medical College and published in BMJ Open Diabetes Research and Care found that both the incremental glucose peak and the glucose area under the curve were reduced by more than 50% when vegetables and protein were eaten before carbohydrates rather than after them. A 2025 study published in Diabetes Care by the same research team confirmed that placing carbohydrates last improved time in range and reduced glycemic variability measured through continuous glucose monitoring. The foods remained identical, only the order changed. The effect on retinal capillaries was dramatically different. After the 2 largest meals of the day, take a 10-minute walk. This is not exercise training. It is not a gym workout. Walk around the neighborhood, walk down the street, and return. Muscle activity during and immediately after eating allows glucose to move directly from the bloodstream into active muscle tissue, through pathways that do not depend on insulin. A 2025 study published in Scientific Reports reported that a 10-minute walk performed immediately following a meal produced a significantly lower glucose peak than either a 30-minute walk performed later or complete inactivity. That makes the immediate post-meal walk uniquely effective for reducing glucose spikes. A 10-minute walk after eating may be one of the simplest forms of retinal protection available. All it requires is movement. The evening period becomes the window for nutrient restoration. Consume a small handful, approximately 30 grams, of raw unsalted pumpkin seeds during the late afternoon or with dinner. Pumpkin seeds rank among the richest grocery store sources of zinc and magnesium. In their raw and minimally processed form, these minerals remain in a structure the body absorbs efficiently. This is food rather than a supplement. That distinction matters. Eat 2 to 3 servings of fatty fish each week. Mackerel, sardines, and herring are examples. These foods provide thiamine along with omega-3 fatty acids that help reduce systemic and retinal inflammation while supporting the structural integrity of photoreceptor membranes. A standard dinner portion 2 to 3 times weekly is sufficient. Consume 2 egg yolks daily. The yolk, rather than the white, contains lutein and zeaxanthin in one of the most bioavailable forms currently known. Its availability exceeds that of dark leafy greens. It also exceeds that of many supplements. A controlled crossover study from the USDA Human Nutrition Research Center at Tufts University, published in the Journal of Nutrition, found that serum lutein levels increased significantly more after egg consumption than after spinach or lutein supplements delivering the same dose. The reason is simple. The natural fat contained within the yolk supports complete absorption. Concerns surrounding egg yolks and cardiovascular risk have been reassessed substantially by research over the past decade. For this discussion, the key point is straightforward. Egg yolks represent one of the most efficient methods available in an ordinary grocery store for delivering macular pigments. 2 each day. The final detail is the one many people reverse completely. Stop eating at least 2.5 hours before going to sleep. The final meal should be finished well before lying down for the night. This recommendation may be among the most important elements of the entire protocol. Photoreceptors, including rods and cones, spend every day converting light into nerve signals. They also undergo continuous renewal. Research published in the journal Cell confirms that the outer segments of photoreceptors are constantly regenerated. Older membrane discs are shed from the tips while new structures are formed at the base, according to a circadian pattern linked to the light-dark cycle. This renewal period serves as the retina's primary maintenance phase. It requires substantial metabolic resources. It also requires a low oxidative burden. Eating close to bedtime elevates blood glucose during the first hours of sleep. That rise introduces the same oxidative stress discussed throughout this presentation precisely when retinal renewal is taking place. A repair process that needs metabolic calm is instead exposed to additional biochemical stress. The result is interference with restoration. Finish eating at least 2.5 hours before sleep. Allow the retina a recovery window by allowing digestion to settle first. This single adjustment may produce one of the greatest benefits within the entire strategy. No glucometer is required to begin observing these patterns. There are 2 simple observations anyone can make immediately. First, pay attention to timing. For the next 3 days, note when vision appears clearest and when blur becomes most noticeable. If visual clarity consistently worsens 30 to 90 minutes after consuming starchy or sugary foods and appears significantly sharper before breakfast, that pattern suggests lens swelling linked to blood sugar. That signal reflects metabolism rather than permanent structural disease. And metabolic signals can respond to metabolic change. Second, keep a 7-day food record. For 1 week, write down what was eaten and record visual quality 1 hour later. Only 2 words are necessary: clear or blurry. Many people who complete this exercise discover a relationship they had never been encouraged to examine. The structure of a typical eye appointment rarely includes questions about lunch or meal timing. As this discussion comes to a close, focus on 5 actions beginning tonight. At the next meal, eat vegetables and protein before starches or sweets. Finish all food at least 2.5 hours before bedtime. Tomorrow morning, prepare 1/2 cup of spinach or kale with 1 teaspoon of olive oil and eat it with 2 eggs. Purchase raw, unsalted pumpkin seeds and enjoy a handful each afternoon. After dinner tonight, take a 10-minute walk. Repeated changes in eyeglass prescriptions often measure the result rather than the source. The source may be a chemical environment shaped by food choices, meal timing, and the metabolic state maintained through most waking hours. That environment gradually affects the smallest blood vessels and the most metabolically demanding tissues in the body. Yet that environment is not permanent. It is not predetermined. It is created by daily inputs. And daily inputs can be changed. Not through a procedure. Not through a stronger prescription. Through meal order, a handful of seeds, 2 egg yolks, and 10 minutes of walking after dinner. The eyes are not the beginning of the story. They are the final chapter. The events leading to this point have been recorded in the bloodstream over many years, in a language no eye chart was designed to interpret. Now the pattern can be recognized. If this information was useful, share it with someone who has noticed gradual changes in vision. The sooner these patterns are recognized, the sooner meaningful daily habits can begin. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.